Your time and expertise are valuable, making focus one of the most important resources to have at work. These days, professionals spend nearly half the work week on written communication, and it can be difficult to stay on task with all the emails and documents you have to get through. With Grammarly as your AI writing partner, you can stay focused and quickly get through your work with relevant real-time suggestions wherever you write. It works across 500,000 apps and websites, so it can help with everything, from brainstorming presentation ideas to sounding more confident and persuasive in emails and reports. For 15 years, Grammarly has offered best-in-class communication support and enterprise-grade security on a business model that doesn't sell your data. 93% of professionals report that Grammarly helps them get more work done. Download Grammarly for free at grammarly.com/podcast. That's GRAMMARLY.com/podcast.
You are listening to Go to Health Media. To reach Jonathan Marks or his guest expert, you may send an email to jonathanmarks@gotohealthmedia.com. You may also visit and subscribe to the website and show at gotohealthmedia.com. And now, back to this week's show. Hey, Jonathan Marks, welcome back to Go to Health Media. We are talking with Dr. Jamil Norman, PhD, RN, and CNE. She's the Associate Dean of the BSN program at Walden University. And coming up on April 17th for Black Maternal Health Week, Walden University is putting on a major event online that you can attend. It's called Improving Healthcare Outcomes for Black Mothers and Their Babies. And you can go there and enjoy it at, I'll give you the link here, it's bit.ly/BlackMomHealth. So Dr. Norman, tell us what's going to be happening in this event and what are you hoping to achieve?
I'm really excited about this event because this is one of those events that you think, I'm going to a webinar, but what can I get out of it? But this is a real world solution to real world problems event. And that's one of the things that we do at Walden University. And I love that we are focusing on Black maternal and child health. And we're looking at how we can improve health outcomes for Black mothers and their babies. So during this webinar or during this series, we have several panelists and several panels to discuss how we are sounding the alarm, how waking up the state of Black maternal child health. We will have several different panelists that really do major work within Black maternal health and women's health and child health. And it's just going to be a great opportunity to network. We'll have a networking session. We also will be talking about how we answer the call. We're going to talk about how we mobilize social change to improve healthcare outcomes for Black women. And then we're looking at some of the scholars and the partners that will help us to be able to enable and sustain that change. So, things like what kind of policies can we make? Where do we go out in the community? How do we also just partner with others who are actually making a change and are out there doing this work right now? And so I'm really excited and think that it's going to be a great place for everybody to kind of come and just have great discussion during these sessions.
Great. And it's open to the public.
It is open to the public, yes.
Wonderful. No fee to
No
join.
fee.
It's just completely educational and open to the public.
Yes, completely educational, because that's the thing. We want people to be educated. We want them to also feel empowered to make a change in whatever way it is. Some people will either want to volunteer with some of these organizations, if they're also already thinking about something that they want to do in their community because there is nothing in their community. We'll have other people that they can discuss some of the changes that they want to make or the impact that they may want to make in their own communities. I think there's something for everyone. You don't have to only be a nurse or a healthcare provider. I think if you're pregnant, you may even want to come to this. Or I really think that anybody, social workers or nutritionists, anybody who has a passion for caring for pregnant women, making sure that their babies are also provided for and that they all have good healthcare outcomes. I think this is a great webinar for everyone.
Wonderful. And the date of it is April 17th?
Yes, Wednesday,
And
April 17th from 10 a.m. to 3 p.m. Central Standard Time.
Great. 10 a.m. to 3 p.m. Central on Wednesday, April 17th. Perfect. Great. And again, where you go for that to watch that and participate is bit.ly, that's bit.ly/BlackMomHealth. So I want to thank you, Dr. Norman, for joining us today and educating us about the disparities in Black women's health during maternity and childbirth. You are the Associate Dean of the BSN program at Walden University. You've certainly provided us with so much. What I really appreciate is evidence-based information on what's happening in Black maternal health. So we're dispelling some of the myths and the rumors with real evidence, and this is the kind of research that you are doing. Dr. Norman is a certified nurse educator with over 20 years of experience as a registered nurse and over 15 years in higher education. Throughout her career, she has served as an agent of social change in the role of educator, researcher, and mentor, and she currently serves as a member of the American Association of Colleges of Nursing Diversity, Equity, and Inclusion Leadership Network. Dr. Norman, thanks so much for being with us today. It's been wonderful to have you, and I wish the best for your event, that you get lots of viewers and lots of people being educated, and that this really works to improve healthcare for African American women.
Thank you so much for having me.
My pleasure. All right, everybody. Thanks for being with us today. Come back again. We'll have another episode of Go to Health. This is Jonathan Marks. Take care. Thank you for tuning in this week to Go to Health Media. Be sure to join Jonathan Marks and another health expert next time. You can also catch the program on your favorite podcast platform. Until our next show, be sure to visit us on the web at gotohealthmedia.com and elevate your life.
At an enterprise level, nothing is more important than communication. Grammarly for Enterprise enables your team to work smarter and faster. Other AI tools can't quantify business impact, but Grammarly gives you actionable insights and measurable results with features like their Effective Communication Score, which tracks key metrics so you can make data-driven decisions to improve outcomes. Visit Grammarly.com/enterprise. That's Grammarly.com/enterprise.
It's Kelly Clarkson here to talk all things Wayfair, the best place to buy furniture, decor, and anything else you can think of to create a home you absolutely love. I know when I shop with Wayfair, I find options for every style, whether I'm feeling boho or farmhouse, modern, traditional, French country. I can find exactly what I need for my home and more. No matter your space, style, or budget, shop Wayfair.com to make your home way more you.
Wayfair, every style, every home.